When 5-year-old Connor Thompson began complaining that he couldn't hear, his parents thought it might be allergies. So they took him to see an allergist at Children's Hospital, who then referred Connor to Dr. David Maggi, specialist in chief of otolaryngology.
He's like, well, Connor looks like he's had a lot of ear infections, which our pediatrician had never found. So he said there looks like there's a lot of scar tissue in there, and he said we should do a hearing test and see if there really is anything to this loss of hearing. So one ear was completely blocked and the other ear was probably about 80% blocked.
What Dr. Maggi found is that Connor's eustachian tubes, which connect the middle ear to the back of the throat, were collecting fluid.
When the middle ear doesn't ventilate properly, children will have an accumulation of fluid, which could cause a hearing loss and possibly, more than likely, infections as well. This condition is extremely common. We see most children in their younger years having anywhere from 3 to 5 infections per year, and many of those kids are struggling to stay healthy with the potential bugs that kind of get in the way of growing up, and the fluid is a good growth medium for those infections. My advice to parents is that when you're having chronic infections, when your children aren't speaking clearly, when there's a hearing problem, that you assess that with your primary physician. When the kids are much younger, under a year and a half of age, sometimes they'll start noticing some balance issues. Children that should be walking at 12, 14, 15 months, they just seem off in their balance. And that's another sign that there potentially could be some ear problems.
Dr. Maggi recommended that Connor have ear tubes inserted into his ears to drain the fluid and prevent further infection.
When we do the surgery, we're basically trying to ventilate the middle ear. And since the body's own tube isn't doing that job, we place a small tube in the eardrum to ventilate the space behind the eardrum that we refer to as the middle ear. So that tube is placed to allow the middle ear to drain itself so fluid can't accumulate, so it's a normal, healthy environment that has air in it. If you look at the very tip of any ink pen, that's about the size of a tube. And the tube is microscopic. The operation is done with the children asleep, so they're not moving and it doesn't hurt them. Basically, we're making a very tiny incision on the eardrum in a favorable location, and we remove any fluid or any buildup of pressure that's trapped behind the eardrum, and then we kind of just wedge the tube right in the space to allow that tube placement to ventilate. Making the incision on the eardrum, we're going to remove any fluid that's trapped in the middle ear space, inspecting as we go, and now we will insert the tube. The tube is a tiny little grommet that looks like a dumbbell. That small little white thing is the tube itself, and we're going to just clean it out a little bit further for you. There's no fluid. We've already removed the fluid that was trapped in the middle ear. That is your tube. That tube will stay in place for 1 to 2 years from the time that we insert it, the entire time ventilating and keeping that eardrum open. That tube will save this child many visits to the emergency room, to the general pediatrician, and prevent all kinds of problems. Surgery takes anywhere from 5 to 10 minutes. That includes anesthesia, the preparations. It's very quick. Recuperation is very easy. It's very painless to the kids. And many kids, after the surgery, they start speaking more clearly, they're hearing better, their behavior improves, they're not as irritable and crabby.
The recovery time was just fine. I mean, it didn't seem to take that long. Connor couldn't do a lot for a week, and he wasn't supposed to get his ears wet for a week. And then after that, you could definitely tell there was a difference in Connor. He could hear everything, where before he wasn't hearing things. What do you like about Dr. Maggi?
Everything.
Everything.
Did he take good care of you?
Yes.
To learn more about ear tube surgery or to schedule an appointment with Dr. David Maggi, log on to dmc.org or call 888-DMC-2500. I'm Emery King.